Hello, PDHP parents and community. I'm Carrie Ann Fitzgerald from the Program for the Development of Human Potential. We are talking about a preventive parents piece. And I went over a little bit of what's going on in our current day and age, especially when it comes to the development of our youth. We see younger use when it comes to drugs. We see gateway drugs are still on the scene, although maybe some of them look different. And we also see these factors that often come into play. One of those factors being ease of procuring said substance. So, I have a question for you today. Where do you keep your medications? Medications from prescription drugs to your over-the-counter items that you use, that you like to have on hand in case one of the kids gets sick, in case you pull a muscle, right? Where do you keep them? Oftentimes, we keep them in our bathrooms, in the medicine cabinet. Makes sense, right? But here's the thing. When I started working for PDHP 5 years ago, I took all the medications out of the medicine cabinet and I transferred them to a kitchen cabinet. Higher up on the shelf, so not easily accessible to my daughter or any of the kids, maybe if we were having a play date. Because the medicine cabinet can be accessed by anyone with a door closed behind them. So, where do you keep your medicines? Consider a safe place. It's ease of procurement. And we are finding that 1 in 5 teens have home access and have taken prescription drugs without a doctor's prescription 1 or more times in their lifetime. This also includes a misuse of their own prescriptions. The majority of teens and young adults obtain prescription drugs that they can abuse from friends, or I should say misuse, I apologize, from friends and relatives without knowledge sometimes. So think about that closed bathroom door. That's a private space. There's this misconception, especially amongst younger aged students, teenagers, young adults, that using or misusing a prescription drug is not as harmful as misusing a illegal drug, perhaps. But we know that combinations of prescriptions, over-the-counter drugs, mixed with alcohol can lead to respiratory failure. It can lead to death. It could lead to overdosing. Non-medical use of prescription drugs among youth ages 12 to 17 and young adults 18 to 25 was the second most prevalent illicit drug being used, with marijuana cited as first. We know that non-medical drugs being misused can lead to addiction. We talked about those problem behaviors that can last a lifetime. It's led to an increase in use of heroin. And we see treatment admissions for heroin or opioids have increased tremendously over the past few years. For example, I have numbers like 222% and 242% in Long Island. And between 2008 and 2011, I have those dates cited as heroin use in New York State high school seniors jumped from 1.8% to 4%. Ease of procurement. If you watch TV between 5 and 7:30, oftentimes we see that prescription drug advertisements are overly publicized during that time. A lot of times kids are home watching TV. There are trends of farming, PHARMING, or farm parties, where attendees bring whatever mix of prescriptions they can find and dump them into containers. They call it Chex Mix. They don't know what drug they're actually taking. That leads, of course, to worries of adverse reactions, possible allergic reactions. Thinking about kids who maybe have an allergy to penicillin and they're popping, a handful of these pills, not knowing what they are. And often these parties, there's also alcohol being used. So that combination is lethal. But again, that ease of procurement. So parents, we have to talk to our kids about appropriate and inappropriate use of medications. We could share this information with family and friends when we're talking to them. Just that idea of moving our medicine cabinet to a more public and safer place. Even maybe getting a little container box and putting it on the high shelf of your closet in your bedroom, parents. That way the kids aren't going into it. There's no reason for them to have that access. Also asking our healthcare providers if medications that are prescribed have any potential for misuse. Safeguarding our prescription drugs and medications at home, whether it's the location or monitoring the quantities and the quantities, first of all. How many are in that jar regularly or in that bottle regularly? How many are set to expire? Because there's also this tendency to believe that, well, if it's expired, it's not as potent. But here's the thing. Sometimes the potency rises. Okay. So that monitoring, disposing properly of old or unused medicines. Sometimes people think they won't be missed if they're expired or if they're old or they're not often used. And following the rules with your own use. Again, we can model these behaviors. And asking those around us to safeguard medications. Especially, if your kids are going to someone else's home, post-COVID, when we are able to go back and have play dates and things of that nature. And talking to our kids, especially our teenagers, about alcohol and drug misuse and risks of misusing prescriptions and over-the-counter drugs. Setting clear expectations that no medication should be taken without parental knowledge. Because they do get caught in these situations where there's alcohol, there's a farm party perhaps. Take this medication, it's mine, you'll feel better after you take it. You'll relax, just take one. That kind of thing does happen. And it can be potentially lethal, as we see. And it can lead to that gateway of opioid heroin addiction, misuse. So consider that. Again, I leave you with that question to really think out. Where do you keep your medicines? Take care, parents. I will speak to you next week further about preventive parenting when it comes to drug trends and how to speak to our kids and when to speak to our kids about them. Take care.